Welcome to the older adult portion of the Growth and Development series. Now, in this video, we're focusing on older adult development, generally considered ages roughly 65 through about 85. This is a very high yield HESI section, especially when it comes to independence, cognition, safety, and distinguishing normal aging from disease. One of the biggest mistakes on exams is assuming that aging automatically equates decline. And that's not simply true, or it's simply not true. Now, with HESI, avoid answers that stereotype older adults as confused, dependent, or incapable. With Healthy People 2030, the initiative that was established for older adults is to increase both lifespan and quality of life for older adults by prioritizing wellness and preventative care approaches. So, in this section, we're going to be talking about, for instance, how to prevent elder abuse. We're going to be talking about social support and different ways that we can support these patients with where they're currently at. Now, according to Erickson, the main psychosocial task of older adult is integrity versus despair. Older adults reflect on their lives and ask, was my life meaningful? When people feel a sense of fulfillment, they experience integrity. When regret dominates, they may experience despair. Now, we see some other issues here and health challenges that older adults face. Financial constraints, living arrangement changes, healthcare access, nutritional maintenance, and accident prevention. Okay, now some of this ends up coming about due to physical changes of aging. So, physical changes in older adulthood may include decreased muscle mass, reduced bone density, slower reaction time, and changes in vision and hearing. So, these changes increase the risk for falls, which is one of the most significant safety concerns for older adults. Okay, we also see some medication considerations. Now, older adults are at a high risk for what we call polypharmacy. So, meaning having multiple medications prescribed to them at one time. Now, because of this polypharmacy, they're also at a higher risk for medication interactions and adverse drug effects. Now, nurses should monitor closely, encourage medication reviews, and educate patients to report side effects. Okay. Now, we also see this become an issue, and this is important to remember, that older adults are more sensitive to medications because they metabolize them more slowly. So sometimes we might even need a smaller dose for the older adult to try to prevent this from happening. As mentioned, safety teaching is a major nursing priority. Fall prevention strategies include adequate lighting, assisted devices, proper footwear, and reviewing those medications we talked about. Okay, now small environmental changes can make a huge difference. Elder abuse is a serious concern and may be physical, emotional, financial, or neglect. Any unexplained injuries, fearfulness, sudden financial changes, or poor hygiene should raise concern. Nurses are mandatory reporters and must report suspected abuse. Now, health promotion remains essential throughout older adulthood. So these include regular screenings, managing chronic illness, maintaining physical activity, good nutrition, and social engagement. So the goal is function, independence, and quality of life, not just longevity. So we see that dental and vision care is still important, cancer screenings, metabolic health, vital signs, and mental health assessments, including alcohol use and depression, are extremely important. Now, the most common cause of sexual inactivity in older adults is loss of a partner. So, main thing with this is addressing the topic with sensitivity, being compassionate, um, and just know that having that sense of intimacy and companionship is still going to be important throughout an individual's life. Now, in terms of cognition, right, we want to make sure that we are keeping an active mind and lifestyle in order to enhance memory performance. So, this includes even engaging in social interactions, doing stimulating activities, puzzles. This is going to help support that cognitive health. Now, for exercise, we're looking at roughly 150 minutes of exercise per week. Okay, so roughly 30 minutes a day would be appropriate. We want to see aerobic exercise, so even think like walking, swimming would be perfect. Some muscle strengthening as appropriate, right? Flexibility exercise and balance training, especially in order to improve stability to prevent falls, is essential for patients. Now, cognitive changes, like we said, can occur with aging, but it's important to know what is normal and what's not normal. So, normal changes include slower processing, taking longer to recall information, and benefiting from written reminders. What is not normal is getting lost in familiar places, forgetting how to perform basic tasks, or major personality changes. So, I want you to remember that normal aging does not equate dementia. Okay. And we also want to make sure, we mentioned it a bit earlier, but preventing depression through social connection. Okay. So older adults still need autonomy. They still need social competence, and that relatedness that they feel is going to help motivate them and prevent isolation and disengagement. So when we're teaching the older adult, we want to make sure that we're implementing some specific teaching techniques in order to fit our patient's needs. So, allowing for more time for the patient to process the information and practice new skills is going to be beneficial. Potentially using larger print or using clear visuals, reinforcing key concepts. Okay, so using multiple modalities to reinforce the same idea or procedure. And using the patient's already existing knowledge to build off of in order to make those meaningful connections. Now, your key takeaways for the older adult. I want you to remember this. Aging does not equal incapacity. Normal aging is not dementia. Fall prevention is critical. Independence and dignity matter. And our role is to support, protect, and advocate. All right, we're almost there. The next video, we are going to be looking at advanced old age. All right, I'll catch you in the next one.